Hello, my name is Michael Kidd and I'm the President of WONCA, our World Organisation of Family Doctors, and I'm very pleased to have the opportunity to address everybody attending this second Congress of Family Medicine, being hosted by the Association of Family Medicine of El Salvador, and my thanks especially to President Victor for inviting me to deliver this short address. Many of you will know that WONCA is our global organisation representing all of us as family doctors, general practitioners around the world. WONCA was established back in 1972, and now we have over 131 countries represented in WONCA, and through our member organisations we represent over 500,000 family doctors in every region of the world. Indeed, the 500,000 family doctors represented by WONCA each year together deliver over 2 billion consultations to our patients. 2 billion. That's the scope of the work that we do. WONCA currently has some very big projects happening at a global level. Firstly, we're doing as much work as we can to support our member organisations, to support you in the work that you're doing, in ensuring that every family doctor in your country is able to deliver the best quality care to their patients, and also to ensure that the quality of the education of people training to become family doctors is strong in every country of the world. We've recently released our new standards for postgraduate education for family doctors, and we're starting to accredit training programs around the world to see if they meet our new global standards. The second big area of focus has been on our work with the World Health Organization. WONCA is recognised by the WHO as the voice of family medicine and family doctors, and we're working with the WHO to make sure that your voice is being heard in the development of global health policy and also in the rollout of global health programs. It's very important work. It's very important that we ensure that the WHO is listening to us about how we can help to strengthen health systems all around the world. Last year we released our new WONCA guidebook on the contribution family medicine makes to improving healthcare systems, and I hope that some of you have the opportunity to review this and also the many other publications which WONCA produces and publishes on our website. Our work with the WHO includes working with PAHO, the Pan-American Health Organization, the local component of the WHO. And earlier this year we signed the Quito Statement in Ecuador with PAHO and with representatives of many countries of Central and South America, looking at committing those countries to working with family medicine to strengthen healthcare in all of our countries. The third big area of focus that we've got at the moment is on working with our young doctors. Our young doctors are the future of our profession, and we want to work with our young doctors to make sure that they're able to be engaged in the work that we're doing and also to have opportunities to develop as future leaders in family medicine. For many years, the WONCA movement has represented young doctors in the Ibero-Americana region of WONCA. Since May last year, we've now seen the development of young doctor groups in all 7 WONCA regions around the world, and it's great to see many of our young colleagues getting actively involved in the work we're doing in global health and supporting global family medicine. I'm very pleased to note that the theme of your conference is looking at chronic disease and primary care. The prevention and management of chronic disease is a core part of the work that we all do as family doctors. In 2011, the United Nations held a summit looking at improving the prevention and management of non-communicable diseases. WONCA took part in this summit, and we noted that the UN at that time was particularly focusing on heart disease, cancers related to lifestyle, respiratory disease and diabetes. But WONCA in our advocacy with the United Nations about non-communicable diseases was to say that we need to be focusing on health, not just on disease. In family medicine, we're very much involved in health promotion and in the prevention of chronic disease. And we exhorted the countries of the world to work with us on making sure that the focus was very much on prevention as well as on diagnosis and treatment. Secondly, we said that the focus needs to be broader than just 4 classes of chronic disease. As family doctors, we deal with the spectrum of medical problems, and therefore all chronic diseases are important to us and to our patients. Also, mental health needs to be looked at in the context of chronic disease as well. And of course, as family doctors, we deal with a lot of comorbidity, with people who have more than one chronic disease. Many of the guidelines which have been developed for our use don't address the realities of managing people with comorbidity. So this is a very important focus for WONCA. And also, we wanted to make sure that any attention on chronic disease looks at not only how do we develop vertical programs to manage individual diseases, but how do we develop horizontal programs to strengthen the base of primary care in each of our countries, so that our primary care doctors and nurses can work together to manage the chronic diseases that occur among our patients in our local communities. So I wish you well in the discussions that you're going to have during the conference. I'm very sorry that I'm not able to be there with you in person, but I hope you have a wonderful conference. I hope you learn a great deal, and I hope you return back to your practices feeling really enthused about the wonderful work that we do as family doctors and the wonderful care that we provide every day to our patients and to our communities. Thank you all for the great work that you're doing as family doctors in El Salvador, and I look forward to meeting with many of you, I hope, in our next WONCA Iberoamericana region meeting being held in Montevideo in Uruguay early next year. Thank you.